Loading of Embazine tandem microspheres with irinotecan HCl. For demonstration purposes, this video will illustrate the loading and preparation of 2 milliliters of Embazine tandem microspheres with 100 milligrams of irinotecan HCl. Embazine tandem microspheres drug loading should be performed under controlled aseptic conditions in order to minimize the risk of microbiological contamination. Do not use liposome formulations of the drugs or ionic contrast agents. Please refer to the Embazine tandem microspheres instructions for use and loading guidance, as well as the instructions for use of the chosen drug for dosage, handling, storage, toxicities, adverse events, and contraindications before beginning the Embazine tandem microspheres device preparation. Step 1. Preparation of Embazine tandem microspheres. Open the tandem box and inspect to ensure that the sterile package is free of damage and its sterility is not compromised in any way. Open the package and gently swirl the syringe to loosen the microspheres. Then, let the microspheres settle to the plunger. Attach a 5-micron sterile filter needle directly to the tandem syringe. Insert the needle into a waste solution bag and expel excess transport solution. Do not compress the microspheres. Remove and properly discard the filter needle. Step 2. Drug loading into microspheres. Attach an 18 to 20 gauge sterile needle to the microsphere syringe. Insert the needle into the drug vial and draw up the required dose of irinotecan directly into the microsphere syringe. Leave an air bubble in the microsphere syringe in order to aid in mixing. Remove the needle and recap the syringe. Alternatively, if using a separate sterile syringe for irinotecan, transfer irinotecan to the tandem syringe via a 3-way stopcock. Mix by gently inverting the syringe every 5 minutes for 30 minutes. Following this loading procedure, 98% plus or minus 2% of irinotecan should be loaded into the microspheres within 30 minutes. Some faint color may remain in the solution. This is to be expected. Step 3. Removal of supernatant. Attach a 5-micron sterile filter needle to the microsphere syringe. Let the microspheres settle to the plunger. Expel as much of the supernatant solution as possible into a waste solution bag. Do not compress the microspheres. Remove and dispose of the filter needle, then recap the syringe. Step 4. Adding contrast agent to Embazine tandem microspheres. Attach an 18 to 20 gauge sterile needle to the microsphere syringe. Draw into the syringe a minimum of 5 milliliters of non-ionic contrast agent per 1 milliliter of Embazine tandem microspheres, or a mixture of both contrast agent and water for injection. Remove the needle and recap the syringe once more. Alternatively, an additional syringe containing the contrast agent or contrast agent and water for injection mixture can be used and transferred to the microsphere syringe via a 3-way stopcock. Gently agitate by inverting the microsphere syringe. The addition of the contrast agent to the tandem microsphere syringe is intended to be performed just prior to the syringe's use in the patient's procedure. Before mixing Tandem with any drug, it is important to understand both the microsphere's instructions for use and loading guidance, as well as the instructions for use of the particular drug chosen for each patient's procedure. This video is not intended to replace the instructions for use or loading guidance. Celanova hopes that this video helps to clearly illustrate the suggested steps for the mixing of Embazine Tandem microspheres.